Thing like that, that would indicate open area. It's important to look at the underside of your feet too, especially underneath your toes right here.
Yeah.
Sometimes they just get sweaty and you have nice warm feet.
Yeah.
I'm going to make it vibrate and I'm going to touch it on your ankle bone. Do you feel that vibration?
Yeah.
That's good. That's a nerve. That
Yeah.
tells me that nerve is working to your ankle. Feel it
Yeah,
there?
yeah.
Very good. The monofilament, to see if their protective sensation is intact. If they can feel this monofilament, there's a good chance they can feel it if they stepped on a nail or a tack.
Yes. Yes. No. Yes. Yes.
Very good. That you have good sensation in your feet. Check a pulse, and that'll let me know that there's enough blood getting down to your toes here. There it is right there. Right there, and in here, there's another pulse that we check. That's good. How much blood is getting to your foot? If it's enough to heal a sore, should you get one?
Yeah.
Oh. This is a Doppler. It's the same thing we use to check fetal heart rates.
Yeah.
You can hear a baby beating in your foot. Hear that? That's the blood flow to your foot. Nice and loud, nice strong heartbeat. But that pressure's over 180. That means you have hardening of the artery.
Step 5. Indigenous practitioners.
I've been practicing for approximately 10 years. In 10 years, I've seen reflexology benefit diabetics in many profound ways. Reflexology is a therapy that uses focused pressure. Focused pressure means that I work a pattern on your feet, and at certain places I apply pressure. And what I'm doing is I'm actually working with the different electrical circuits that we have in our body. If you look along here, you can see the spiny process. That actually relates to your spine. So by working, if there's a spinal injury and I work along this area, I can tell exactly where the problem is happening in the spinal process. On the bottom of your foot here, if you look at your feet, you look at your body, you look at your hands, they're all set up the same. For instance, if we started at our toes, that represents our head, which is the top of our body. In through here would be our neck area, the same with our hands and our body. We even have our lungs on our feet, the same way we do with our hands and our body. So that means that, you know, we have a stomach area, and all of our other parts for our digestive system are here. And we have, you know, the hip. So we have everything included in our feet. Reflexology is actually an ancient technique used by all of our ancestors. As a matter of fact, reflexology in its modern day is the result of a European coming over and studying our traditional healers and going back to England, I believe it was, and then putting together a methodology. It's been a part of our healing methods for centuries. As a matter of fact, when we used to wear our feet with our moccasins in the forests, we were actually doing our own foot treatment back then. And now we've adapted to different ways, and now we have reflexology help us keep our feet in good condition.
Nice and fresh. And you have a nice, fairly high arch. Most people with bunions, they have difficulty finding proper shoes.
Yes.
So you have to go to a foot clinic or see a foot doctor. They actually have to measure your foot when you're standing. You have to buy shoes later in the day because your feet swell. Okay? See how wide your foot is?
Yes.
Okay? You need to get your shoes that are that wide. Okay? Imagine this is your toe. Imagine this is your nail. Okay? You're looking at it from the top. Okay? This part of the nail that you can't see. Okay? Now most people, when they have ingrown toenails, they cut the toenails very short or they cut corners. Okay? So now you end up with a nail that looks like that. Okay? Because you cut corners, right? As the nails grow out, now you have a bigger area of ingrown toenail.
The feet are marvelous tools. We take it for granted that we always have them to walk on.